Hi guys, it's the one and only Erica J, and I'm coming to you with a video about what happened to me after I left Detroit. Now, this is my first real life, real time update since the surgery. So I know I've been posting a lot of information. I know my videos are super long, but I didn't find anything on plus size tummy tucks. I knew that I wanted one. In my head, I just wanted to get rid of my belly. Um, I didn't, to be honest, 100% honest with you guys, I did not realize how large I was. I didn't know how much weight I had gained because I was inside of myself. And even though I took those pictures and everything, I didn't realize like the big difference until like after the surgery until now. So, unfortunately, after my tummy tuck, I had every complication you can imagine. I had a pulmonary embolism. I had a seroma. My wound is basically it reopened. I had infection to my right drain. I was hospitalized for 17 days. That is very scary. I could have lost my life. You know, during this whole ordeal, I never thought or imagined that I would like die, but I could have. You know, I could have literally died. I could have literally lost my life. So basically, I had like several consultations. All the doctors told me that, oh, after the tummy tuck, you only need a week off after the tummy tuck, and then after that, you should be able to go to work. So I initially, flew to Detroit on a Sunday. I had surgery on Tuesday, and I was planning to go back to work the following Tuesday. So we flew back home on a Monday. The flight home was horrible. I was very uncomfortable. I didn't realize how much swelling I had after the tummy tuck. All my fluid went to my hips and my thighs and my butt. So sitting in the seat was very tight. We flew back American Airlines, and what we found out is the little seat. The armrest didn't move. When we flew there, we went United, so we was very comfortable. You know, I did have wheelchair handicap accessibility, so we had a lot of leg room, but I was just so swollen, so it was uncomfortable. After the flight took off, I started to hyperventilate. I was like really short of breath. I was really in pain. The stewardess gave me a bag to kind of breathe in. I was trying to slow my breathing down. Chris had to actually give me 2 Percocet on the flight, which it helped. I was able to go to sleep. We arrived. That was very uncomfortable, getting in a wheelchair, walking to the baggage claim, getting my bags, but I was so happy to be home. I was just like elated. My daughters came to pick us up from the airport, and the car ride home, every bump, every turn, every curve, it was so painful on my incision. When I got home, I took a shower later on that night. I was in excruciating pain, so I took some pain medicine. I was supposed to have help. I will tell you this: anybody that gets it, especially if you're large, I can't speak to nobody else. I can just speak to my experience. You do not want to go home and be home alone after your tummy tuck. When I was in Detroit, my husband had to do literally everything for me. He had to wipe my butt. He had to help me bathe. He had to do everything. I did walk every day in Detroit. I did wear my compressions. I did feed myself, but I still required a lot of help. Again, I was so swollen, and I have an extended tummy tuck. So I'm gonna post pictures at the end so you can see how far my back my incision went. But I couldn't twist. You know, when you go to wipe your butt, you twist and you wipe. I couldn't twist. Wiping the front is an ordeal because I had 2 drains coming out the front. Um, so basically, get home. I want to take a shower. Chris was like, no, but me, I want to take a shower anyway. Got the shower chair, put it in a tub, got cleaned up, and again, just really uncomfortable. I was supposed to have help to come and be with me up until like Friday. My help never showed up. So I was home by myself on Tuesday morning. I didn't have any assistance throughout the week. make sure you confirm, double, triple, dipple confirm that the person that's going to help you after surgery is going to be there. My husband had to go back to work. My kids had to go to school. So literally, I was home alone. Tuesday, I was supposed to work. I worked from home, but I wasn't able to get any work done because my body was just too tired. Just the airplane ride home, I was drained. Um, when I woke up Tuesday morning, I realized my leg had fallen off the chair. I slept in a chair that night, and every night after I got home, I slept in a chair. I do have a recliner, but the recliner was just uncomfortable, so I sat in a computer desk chair. But anyway, my right leg fell off the other chair that I was sitting on. So I didn't realize it, but because my leg had fell, I was home by myself. Nobody was there to check on me. I don't know how long my leg was down. My wound opened on the right side. I started to have excruciating pain in that right area. I called Dr. Gray. They told me to do wet to dry dressings to the area, so to make sure it don't open up. Dr. Gray pulls you really tight, so you have to be very careful with your incision. But I pretty much think that the flight home and the ride home and all of that moving and shaking really put a lot of stress on my incision, and it made it difficult. If hindsight 2020, I would have stayed in Detroit longer, another 5 days to heal better. That's just me, that's my opinion. I would have stayed. Instead of going home on that Tuesday, I would have stayed and went home that Friday. Who knows? But it's just, what I think would have been better for me. So that was Tuesday. My wound opened. I was home by myself every day. I had to try to do my dressing changes during the day. And guess what? Trying to do it by myself, it opened up even more because I didn't have any help. By the end of the week, my niece said she would come over to help me. And when she got there, she was looking at my drain. And she was like, Erica, you have pus coming out your drain. I immediately called Dr. Gray. They already knew about the wound opening up and the dressing changes and all that. They called my pharmacy here and ordered me some antibiotics, 2 different antibiotics to take for the pus coming out the drain. The right drain. I was recording my drain. I had a lot of drainage. I had a lot of swelling. So my drains weren't ready to come out yet. So I was supposed to pull my own drains. I am in healthcare. I have friends that are in healthcare. So I was going to have one of my girlfriends come over and pull my drain for me. That was the plan. However, we never made it to that part. Again, drain was infected on antibiotics. The pain to the drain was like the worst thing ever. That's worse than the incision pain or the soreness that you have. It's just worse than everything. After being on antibiotics for 3 days, the pain to the drain started to subside. I thought I was doing better. Mind you, all the doctors told me I could go back to work a week after surgery. That was not true. That whole first week, I didn't get any work done. I got work done, but I wasn't as productive as I could have been. The second week after surgery, I was like, you know what? I got to get on it. I got to get my work done. So that Monday was kind of productive. I didn't have as much pain, but I still wasn't 100%, of course. But I think that Sunday night, like over the weekend, I started to have like chills. Like I was like getting so cold that I was shivering, and they had to put a whole bunch of blankets on me. But every time I would take my temperature, I didn't have a temp, so I was like, I don't have a fever. I didn't know why I was just getting cold. Lo and behold, I had an internal fever and didn't even realize it. I made an appointment on Monday to go to my primary care physician. So on Tuesday, I went to see my primary care doctor. That the girl did my vital signs. I knew I was breathing heavy. I knew I was short of breath, but she didn't tell me my other vital signs, and I really didn't ask. My big concern at the doctor appointment was my incision and getting wound care and the infection, right? So that was that. He looked at my antibiotics I was on. He was like, that's good. Continue those antibiotics. Make sure you complete them. He gave me a referral to wound care, and I was short of breath, but everybody say you're always short of breath. So I didn't even look at, you know how to give you the discharge summary? I didn't even look at the discharge summary or anything. I just put it in my purse and went out in the field. When I was out in the field, God was with me. My client declined my visit. After that, I went home. I literally went to sleep from the time I got home until the next day. Literally going to the doctor, going out in the field, all of that just literally drained everything out of me. So Wednesday morning, my husband had to get up to go to work. He helped me do like my wound care before he went to work. And then after that, he got me set up in my chair and I went to sleep. I woke up to the phone ringing and I just felt off, like I couldn't really move. It was my cousin checking on me. She was like, "Hey, how you doing?" I was like, "I'm not doing well." She was like, I said, "Can you come and check on me?" And she was like, "Well, yeah, I'll come and check on you. I just have a few errands to run and I'll be there." So she hung up and I kind of like dozed off again. And then my good girlfriend called and she was like, I could barely like even answer the phone. At this point, I couldn't hardly talk to her. And she was like, Erica, you don't sound good. You know, are you okay? And I was like, no. She was like, I'm on my way right now. She dropped everything she had going and she came right over to my house to get me to, you know, try to check on me. My husband locked all the doors. So I was literally locked in, which is a good thing, but she couldn't get in. So she wanted to call 911. I was like, I couldn't move. I couldn't get out the chair. So I didn't want them to bust the doors down. I was just like, just be patient. Just give me some time. I was talking really slow though. I was like, just wait. You know, I'm gonna get up. So after a while, I was able to literally get up. It took me forever to walk to the door. So I walked to the door. I opened the door. She came. She helped me get dressed. We went to the hospital. I told the nurse, I think I'm septic. I have an infection. And I've been getting chills. You know, I'm just weak. I can't, you know, hardly move. So they did all my vital signs. My normal blood pressure runs between 110 to 118. So my blood pressure was like 129, which was a little high for me, but it wasn't like anything to get excited about. My heart rate was definitely elevated. When I got there, I can't remember exactly what it was, but my heart rate was elevated. So, because I told them I thought I might be septic, they rushed everything. So she was like, hold on right here until we get you a bed. So the registration lady came. I was in a wheelchair. My friend had to go move her car because she parked literally right in front of the ER. So while she was moving her car, the registration lady came and got me and was trying to give me my information. I remember handing her my driver's license and my insurance card, and I literally went out. Like, I went totally... I can't say totally unresponsive, but for a healthcare professional, when someone eyes are closed, they're not responding to you, they're pretty unresponsive. But being a patient, I could hear everything around me. It was so crazy. I could hear everybody talking, but I couldn't move. I couldn't open my eyes. My head was like this. The nurse came to get me. She was like, Miss Jordan, you know, trying to get me to talk, speak. I couldn't do anything. They wheeled me to the ER room. The nurse did was something called a sternal rub, trying to get me to respond and wake up. It's what we take your knuckles and they rub you deep into your sternum. And she did it. It hurt so bad. I could not scream. Like, I couldn't scream. I couldn't make a noise. I felt it. I heard her talking to me, but I couldn't do it. It was like I was paralyzed, you know? So she did it again, harder this time. I still, like, could barely move, and I was trying to tell her, like, stop, you know, it hurt, you know, but I couldn't. So then she did a third time. Man, I thought this lady's gonna break my freaking rib cage, and I barely like jolted, and I lowly like opened my eyes, and I saw this man. It was the doctor. He was like, Miss Jordan, you gotta get up, we gotta check you. I'm like, I couldn't move. I couldn't even reply to him. So by this time, my friend came in. They helped me. They get me on the table. You know, I really don't remember. It's like asking me all kind of questions. And all of a sudden, I kind of started to like wake up a little bit. And so I was able to talk to the doctor. I had 3 nurses in there. They were all trying to get IVs on me. No one could get an IV. At this time, my heart rate was like in the 130s. I had told him I had went to the doctor the day before, so I had went in my purse and got my discharge papers from my primary care physician. Looked at the numbers. My heart rate the previous day was 120. My respirations were 24, and I had a low-grade fever. The doctor or the medical assistant reviewed my vitals with me the day I was there. The ER doctor said he should have sent me to the ER the same day. Like, I should have went to the ER Tuesday, but I left the doctor going in the field and all of this, and no wonder I was drained. You know, it took everything out of me. So they couldn't get a IV. I kept going in and out. Literally, I kept having those episodes. It was so weird. It was like I'll go limp, and then I couldn't talk. I couldn't move. I do anything. They started IV. They was rapidly infusing IV. They had the rapid infusion. Oh, back to the IV. They couldn't get an IV, so they had to put me upside down. The ER doctor had to come and put an IV in my neck. Literally had to put an IV in my neck because I was so dehydrated, and I was drinking plenty of water, but I was just so swollen. It's like all of the fluid was third space, and it was just going to my tissues. It wasn't, my body wasn't absorbing the water, I guess. I don't know, but they put an IV in my neck. That was so freaking scary. I was awake. He was like, take a deep breath in. I'm like, oh my God. I was so sick, The problem with the IV, they laid me flat. Now, my wound had already started to open up a little bit, and I will put pictures at the end. But when they laid me flat, what do you think that did to my wound? But they didn't care about my tummy tuck. They was trying to save my life. Because if they couldn't get an IV in me to give me medications, then how would they be able to help me? So at the time, my husband was at work. My good friend, she was there with me, but she had to leave because she had to go get her daughter from school. So my mother-in-law came to the hospital with me. By this time, I was in and out, in and out. And I remember looking up at the blood pressure monitor, and my blood pressure was like 170 something over 90. And I was like, that can't be my blood pressure. That can't be my blood pressure. I say, nurse, cycle it again. And she cycled it again. It went to like 200 over 105. I like started crying. I don't have high blood pressure, guys. And when you're large, people assume you have high blood pressure, but my blood pressure runs 110 to 118. That's my normal, right? So for my blood pressure to be that high, I just got so scared. I was like, I'm really sick. My heart rate went up to like 160. Like, I had a fever of like 100. I can't remember, but I had a fever, heart rate elevated. I kept telling them it's the drain, it's the infection, take the drain out. The ER doctor was like, no, we can't touch the drain. So people who go out of state, people who go out the country, when you go to the ER, they will not touch your drain. They say that a surgeon has to remove your drain. They knew my surgeon. So they did a consult for the hospital surgeon. She came down, she was really nice. She ordered a CAT scan. So the first time I was laid flat is for the IV in my neck. She ordered a CAT scan. I kept telling them I can't lay flat. They took me to CAT scan, and guess what they did? They laid me flat a third time. So after the CAT scan, the surgeon wanted to come in and examine my stomach because she said, she wanted to review the results. She laid me flat a third time. And I told her, I said, ma'am, I just had a tummy tuck. Do you have to lay me flat? I mean, because she's a plastic surgeon. And I'm like, I can't go flat. But she's like, I have to see what's going on. So she laid me flat. My abdomen was so swollen. It was just like huge. She said that the CT showed that I had 2 seromas in my upper left quadrant, but the lower part of my stomach, like from my belly button down, was so swollen. That's what she was concerned that it was fluid at, but it was no fluid. It was just like a lot of swelling and things like that. So lo and behold, they admitted me. So that night, the internal medicine doctor came because of the fever and all that. He came to assess me, and he made me lay flat again. So lay flat 4 times in one day. They literally ripped my incision open with being laid flat. And I understand, now, and, the healthcare professional, they were trying to save me. They wasn't worried about my tummy tuck. But because I was laid flat those 4 times that day, and then the next day, the plastic surgeon came to see me again. She was like, your heart rate it's still too high. It was like 120, 130s. And she's like, you're breathing too fast. I'm ordering another CT. So next day, get laid flat again to go to CT. And later on that day, they came to me and told me, Miss Jordan, you have a pulmonary embolus in your right lower lung. I could have died. I was just like, wow. Made me remember that when I was on an airplane, I felt really, that's okay. So a pulmonary embolus is basically a blood clot that you have in your lower extremities that move, it travels, and it went into my lungs. Good thing it could have went into my heart, it could have went in my brain, it could have went anywhere, but it went in my lungs. That's why I had so much shortness of breath. I don't blame the doctor. I blame myself. I know better. I told you guys that I had a lot of swelling in my legs and my thighs. So I had the medical grade TED hose on, but my thighs were so swollen that they were cutting into my thighs. I should have cut the TED hose, but me, the smart one, took the TED hose off while I was there. And I really didn't wear them until the flight home. I put them back on, but like when I was there in Detroit, I did not wear my medical grade TED hose every day. That is a no-no. If you have surgery, wear your TED hose every day, especially if you're gonna fly home. Then I went to sleep on the plane. But I think that blood clot dislodged out of my leg and went into my lungs while I was on the plane, because that's when I experienced so much shortness of breath. The Seroma, I did that. I watched a lot of information, but nothing told me about massaging my stomach. So when I had my tummy tucked, the top of my stomach was so tender. So I would sit in the hospital bed, like in the hotel, and just rub my stomach. And when I went to see Dr. Gray, I told him, well, I've been massaging my stomach. He was like, no, don't do that. He said, your stomach, I lifted it up. It has to adhere back together. And if you're massaging it, it won't mesh. Do not massage your stomach with the tummy tuck. Do not massage your stomach, because when you're massaging it, it will not fuse back together. Now, when you get liposuction, you can do all the massaging you want in those areas. But when you get a tummy tuck and they lift that top piece up and the bottom piece is here, you want it to fuse together. So I was massaging it. But once he told me to stop massaging it, I did stop massaging it. But I think that was the cause of my seroma. I don't know, I'm just telling you what Dr. Gray told me, and after he told me that, I stopped, but I ended up with a seroma, so go figure. So the wound opening up, I was at home by myself, didn't have any help, trying to move around. That is a no-no. You need help with you so your wound won't open up. Infection. I've been in healthcare 18 years. The infectious disease doctor said it was most likely a bacteria that I already had on my skin. And the surgery just took so much out of me, and it just made it an opportunity for the bacteria to grow. I wasn't taking any vitamins. I wasn't taking vitamin C or anything to boost my immune system. Note, if you're going to have surgery, you need to take anything that can boost your immune system to help you fight off infection. I didn't do that. Was a big girl, but I was totally healthy. Never had infection, never had any issues. So make sure you take, vitamins and stuff like that to kind of help you fight off infection. Make sure you clean around your drains really good. You follow your post-op instructions per your plastic surgeon. Dr. Gray's post-op instructions is to take a shower the first day post-op with the antibacterial soap. I don't think I took a shower that first day. I took a shower the second day. It was very uncomfortable. I was very tight, but just hygiene, making sure your drains are clean, making sure they're not touching the toilet, touching the floor. We were in a hospital. When you have surgery at home, when you come home to your germs that that's always good. Who knows how I got the infection, but that was like a super infection. When I was in the ER, they put me on two different IV antibiotics. Been in a hospital. Again, the hospital I was at, it was 50-50. 50% of the time I had good nurses, and then 50% of the time I had students, and that didn't really go well with me, but that's another story. But when I was in the hospital, I was there for about 5 days. My infection, my temperature wouldn't break. I stayed with a low grade fever, like 100.3, 100.7, things like that. My heart rate was still elevated. It was like 110. It wasn't like high as it was in the first days, but it went down. But, everything was kind of improving. My fever wasn't as high. My heart rate wasn't as high, but it was still high. My breathing, was okay. But day 5, out of nowhere, my fever spiked to 102.7. Like 102.7. My doctor freaked. They rushed me down to do all kind of tests in the middle of the night, because this was like at like 9 or 10 o'clock at night. They rushed me down to do like all kind of x-rays to figure out why my fever spiked. They did not have a clue. Temperature spike. They changed my antibiotics like 2 or 3 times over the course of 17 days that I was in the hospital. Told you about the IV in my neck. I couldn't keep that for a long time, so like after a couple of days, they had to come and put a PICC line. I still have the scar right here where they put the PICC line. The PICC line goes in your arm up into the top part of your heart. Because I have my veins are pretty much trash. If I get an IV, it doesn't last for 24 hours. So on top of being a hard stick and everything else, it was just crazy. So my kids were freaking scared. My husband was scared. It was just like one of the most scariest experiences I've ever had. Like, I've never been in a hospital. The other thing about the hospital, they only had one wound care nurse in the whole hospital. And guess what? She went on vacation. So I had no one to manage my surgical incision while I was there. Like, the nurses, they really didn't know what they were doing. I really didn't get proper wound care. So guess what? I developed a wound. The worst thing, like, I had so much swelling. The surgeon that found my pulmonary embolism, the one that saw me in the ER, I'm thankful to her for all of those things, but she refused to follow me. She refused to take me on as a patient. So my infectious disease doctor, I used to work at that hospital, so he went above and beyond for me. He contacted one of his friends that was a plastic surgeon to see if he would accept me and touch me. Because listen, guys, no plastic surgeon wanted to touch me at all. They were like, nope, 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 nope. I had 2 plastic surgeons that was willing to take my case on, which was amazing. I told you guys that I had swelling from my belly button down to my incision line. So one surgeon, he was a younger guy. He was like, I'm going to just cut it all out. I'm going to cut that whole area out, put a wound vac on it, and let it heal. It's called fat necrosis. Not the typical necrosis that you guys see all the time. And that's why I'm making this video too, because I can't find anybody with fat necrosis. And it's basically, my incision never turned black, even though the wound is his. It never turned black at the incision line. But underneath the skin, it got really hard. That fat died. It did not get enough blood flow to the fat. So the fat died, and it made a very, very hard lump. It was the size of maybe two grapefruits. It was really big, and I'll post pictures in the end so you can see it. It was very hard, and it was underneath the skin. And he wanted to cut a hole and remove it, and I was like, no, you're not cutting a hole in me. You're not doing it. No. The other surgeon was the one that my infectious disease doctor, that was his friend, and he was like, no, don't worry about it. We don't have to cut it. He said 6 months to a year, your body will reabsorb the fat, and then you don't have to worry about it. You know, it's going to take a while to heal. I guess he was telling me what I wanted to hear, because I definitely wasn't trying to hear getting my stomach cut, like a hole in it, and everything like that. I talked to Dr. Gray's office was in contact with the hospital. They would call me every day in the hospital to check on me. The hospital was giving me a hard time getting the medical records and everything to Dr. Gray, but Dr. Gray was really trying to, talk and figure out what was going on and how he can assist in the best he can. So I would say, as far as him following up, the infection, the doctors here, everybody said the infection had nothing to do with Dr. Gray or his clinic. It's just something that happened. I don't blame him for it. You know, these are just a risk of surgery, period. You're at risk for infection. You have an open wound. You can get infected. But I will say he did follow up and contact me, and I had his personal cell phone number to call him directly, not to call the office, but to call him directly, and I still have it in my phone. His personal number to call him directly if I needed anything, because the doctors were rounding at different times, and you know, he wanted to like figure out what was going on. So I think I covered everything I had. I had a pulmonary embolism from the flight, from removing my tent holes. My wound opened up. I got a drain infection just overall, because I was really sick, in the hospital for 17 days. Had to come, because of the seromas, at first they watched them for the first couple days, but had to go get another CT, and the fluid started to accumulate more, so I had to go to like interventional radiology so they can put another drain in me. So not only did I have the 2 drains at the bottom, but then I had a drain at the top. None of the doctors want to pull my drain. It was literally, I chose Dr. Peterson here in Houston to be my doctor in the hospital. So it was getting, you know, after like when it was closer to the last like 2 or 3 days, my fever went away, my heart rate went down, but I was so weak. Oh, I forgot to tell y'all this. When I was in the hospital 17 days, I was so weak, I could not even lift my hand off the bed. I was a 2-person assistant. It would take the nurse and the CNA to help me go to the restroom. Now, mind you, being in a hospital bed, having to get up to go, they were giving me fluids. I had to pee a lot. I had to keep getting up. All that twisting. Guess what that did to my tummy incision? Ruined it. But I was just so weak. Sometimes I did the bedpan. Sometimes I got up to the restroom. It was just a horrible experience. 17 days is a long time. Most people be in the hospital 2, 3 days, 5 days. I was in there 17 days. So just make sure that you do proper hygiene. You take care of yourself, because you don't want to end up in a hospital like me. So once I got discharged, the day I got discharged, Dr. Peterson removed my drains from my pubic area. That hurt. Okay? They had been in there at that point, like, I was in a hospital 17 days, probably 21. They had been in me over 25 days. And when he removed them, it hurt. It really hurt. But anyway, he did remove those before I left. I wanted to get the seroma drain out, but he wouldn't remove it. He wanted to make sure everything was dry. I was like, he wanted me to follow up with him after I got discharged from the hospital. So, get discharged from the hospital. My husband had to take off work to literally care for me. I could not dress myself. I felt a little bit better, but I still was weak. If you don't use it, you lose it. And I was walking, but I had physical therapy in the hospital. Like, they literally had to have to give me adaptive aids to show me how to put my socks on, I had a reacher like an old lady. I had a walker, I had a reacher, I had all these things. It was just crazy. The hospital wanted to send me to a rehab after I was discharged, but the insurance denied it. So I got sent home with a skilled nurse to come 3 times a week to see me. So when I got home, my husband had to help me with everything. He took off work 3 weeks. The first 2 weeks, I couldn't be by myself, because I needed assistance. I still needed help. By the 3rd week, I was able to do a lot more. But just think about how much financially that hurt. My husband having to take off 3 weeks from work, and I had to take off, and he has his own business, so if he doesn't work, he don't have money. And then me, I had FMLA, but it only paid 60%. I know a lot of people's FMLA paid 100%. Mine paid 60%. And it didn't even kick in until 2 weeks after I got out the hospital. So I had to get like back pay. So financially, it really did hurt for me to be off work. I was out of work once I got home, 6 weeks, not including the week for the surgery and then the week that I was supposed to be working that I couldn't really work. So that's a total of 8 weeks total. It's how long it took before, you know, I was able to go back to work and feel somewhat better about myself. My nurse was amazing. She's really nice. She's really patient. She came 3 times a week. I'm gonna post my stomach, how it looked when we first started with wound care. When I was in the hospital, the tape irritated my stomach. So the black that you're gonna see on my stomach is not necrosis. It's a scalp from the tape. The tape that they were using on my stomach really irritated my skin, and so I had a lot of all over my chest and on my arm. The tape just peeled my skin off, so I had like a lot of marks and stuff all over me. But I am gonna show my wounds. It's very graphic in nature. If you have a weak stomach or if you're squeamish, you do not need to watch, you know, that portion of the video. I still have the fat necrosis right now. I am 5 months post-op. I still have the fat necrosis. I'm going to show you guys a picture of my necrosis, how it looks right now, and what the plan is to go on for the future. I'm still under Dr. Peterson care. I go to see him once a month. When I first got to the hospital, I went to go see him every week. Oh, let me tell y'all, the plastic surgeon that followed me after I got out the hospital, when I called to make my follow-up appointment, she was like, okay, well, the visit is $150 and you still owe for him seeing you when you were in the hospital. I'm like, what do you mean? I had health insurance when I was in the hospital. She was like, yes, but we don't bill insurance. What? Nobody told me that. So both plastic surgeons that came to see me, just every time when I was trying to figure out which one I wanted to choose, and they was trying to see if they wanted to take me on as a patient, every time they came to see me, they billed me for that. They billed me for that. And guess what? It is not covered by the insurance. I have to pay out of pocket. You will not believe the medical bills that I have. You will not believe the medical bills I have. And then on top of that, the ones that I have to pay out of pocket. Good thing, the infectious disease doctor, Dr. Castillo at Houston Northwest Medical Center, he is amazing. Dr. Peterson cut his fee from seeing me in the hospital in half. The lady was like, well, you pay us $500 from the time he saw you when you were in the hospital and $150 for your visit. And they really worked with me because, again, I was out of work and I needed to see the doctor because without seeing Dr. Peterson, I couldn't continue with my wound care because he had to sign her wound care orders. So it was just like really, really crazy, you know. But I had to pay, you know, what, $650. But I paid him $650 when I got out of the hospital. I haven't paid him any more money. He's been seeing me once a week at first and once every 2 weeks. Now we're at once a month. He's still monitoring my necrosis. I know I showed you guys my belly button when I first got out of surgery. I had an innie. Well, Dr. Gray doesn't, when you're really, really big, and this is not every doctor, but when you're really, really big and you have a large stomach like I do, he makes a fake belly button and he tells you the fake belly button will hold up. If you look at his pictures, you'll see people belly button and they look kind of small. And I was like, Dr. Gray, I don't want a small belly button like that. So he made me a nice big belly button. But due to all the complications, the swelling, the fat necrosis and everything, I lost my belly button. So I am flat. So I do not have a belly button at all. So My belly button, my real belly button is under the skin, and now that all the swelling and everything went down, I can go back to Dr. Gray and he's gonna fix my belly button free of no charge. And he tells you that, and when I did my research, I already knew about the belly buttons and everything like that, and I had asked him when I was there if my belly button went flat, would he fix it? He says yes. At 3 months post-op, he will pull your original belly button out. And that was just because my stomach was so large. He does not do any lipo to the abdomen at all with his tummy tuck. He does lipo to the sides and the back with your tummy tuck, but everything's a la carte and you have to pay extra. I already knew I needed to get liposuction. I just opted not to get liposuction because I figured, why get liposuction to my back and my sides and then have to go back and get liposuction to my abdomen? So my original plan was to get the tummy tuck and muscle repair with Dr. Gray and then wait 3 months and get 360 lipo. Well, that didn't go accordingly because of all my complications, been in a hospital, and my fat necrosis is still really hard. They can't liposuction it because they can't put a catheter through it. So, like I said, I'm 5 months post-op. I'll be 6 months. It has gotten softer. It has gotten smaller, but it definitely pokes out. I look 100% better in my clothes, so I feel a lot more confident. I still swell a lot. So I still have to wear compression to kind of manage my swelling. I think my weight was 230 to 240, give or take, or whatever, 235 to 240. I think day of surgery I was 243. So I'm down to 210 pounds. So that is a significant loss. I am doing right now, I just started intermittent fasting, and that seems to work for me, to help me. I'm not gonna lie to you guys. I haven't been like eating a special diet or anything like that. All right, thanks. Don't forget to like, comment, and subscribe.